Hello, hello, and welcome back to another thrilling episode of Take Care of Yourself, the podcast where we talk about all aspects of getting into that doctor for some healthcare self care. We always love to remind you at the beginning of each episode that we are here to provide you with information, but you, the dear listener, must take our words and put them into action. Today, we are continuing our series on the National Standard for Culturally and Linguistically Appropriate Services. We're going to talk about a new health disparity: language barriers. Number 5 through 8 in the CLAS, yes, that's the Culturally and Linguistically Appropriate Services standards. They talk about language barriers and how we should address them in healthcare. These standards sound a bit like the 10 Commandments of healthcare equity, am I right? Let's start out by reading numbers 5 through 8 in the standards to get an idea of what we're working with here. We did get these standards from our journal sourced article titled Strategies for Implementing the National Standards for Culturally and Linguistically Appropriate Services in Home Healthcare, which was printed in the Home Healthcare Management and Practice of 2017. You can find more information on this source and others in today's show notes. Communication and language assistance. Number 5. Offer language assistance to individuals who have limited English proficiency and/or other communication needs at no cost to them to facilitate timely access to all healthcare and services. Number 6. Inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. Number 7, ensure the competence of individuals providing language assistance, recognizing that the use of untrained individuals and/or minors as interpreters should be avoided. Practice easy to understand point and multimedia materials and signage in languages commonly used by populations in the service area. Now, last week we talked about cultural competency. If you remember, that was the one that demanded that we enter with a good attitude, worldview, and knowledge of other cultures. As I expressed last week, I think it's very important, and as a healthcare administrator, I would create education programs surrounding this topic to make individuals more culturally sensitive. I think this plays into language barriers. As healthcare workers, we must recognize the need for translation services, even if the patient themselves isn't aware of it. Providing that translation services can help ease the stress of the patient. We must address these situations with humility, as these issues can be sensitive for patients. It would be offensive if we were just to walk in and make them aware that we're calling translation services if the patient feels that they can handle the conversation. We also have to have cultural awareness, understanding what social norms are for our patients in order to provide them with the best possible care. We have a new term for you today: intersectionality. Now, I've heard this word thrown out around a lot, and I haven't quite understood its meaning until I read this article by Global Citizen. They state, and I quote, intersectionality is short in a framework for understanding oppression. This idea came when a Black person faced discrimination, and she was upset because it was clear to her that her oppression was multidimensional and included racism and sexism, and the two should be considered together rather than separate. I think oftentimes in healthcare we have implicit bias that we aren't even aware of. When we consider this term of intersectionality, our implicit bias can increase. How does this affect access to healthcare? Well, how do you think a Mexican day worker experiences implicit bias? Do you think a non English speaker is often stereotyped in this situation? Do you think that their oppression is doubled or tripled due to their language barrier? How should we break down that barrier? The solution? Access to language services. Language barriers are considered health disparities, and they hinder the individual from getting the health care that they need. As a healthcare administrator, I would guarantee my facility has access to these language services of multi sources, such as in person, online, or over the phone. Language access can help open up doors for the individuals and allow them to live longer. Marinate on that one for a second. These services can help patients live longer. Time is a limited resource, and we would all like to have more of it. To simply provide language services to someone, they can live a longer life because that allows them to get access to the healthcare they need. We need quality improvement in our healthcare systems. We all know that this stuff gets overlooked at times. This is a call to arm to all healthcare administrators, myself included, to increase the cultural awareness, make sure that language services are readily available, easily accessible, and that all staff has the knowledge to make the call. Thank you for your time today. Thanks for tuning in. Please come in next week for more Take Care of Yourself, the healthcare podcast where we talk about all aspects of getting into that doctor for some healthcare self care.